Hello everyone and welcome to Vision Australia's webinar on making the most of our NDIS plans. I am Scott Jacobs from Vision Australia. I'm the Program Manager of NDIS and Aged Care. I will go around and we'll introduce our other panellist, Caitlin McMorrow. But before we do, I'll just go through some housekeeping. So to begin with, this is going to be recorded, so we're able to share the recording later for anyone who is unable to attend or who might have joined in late, and we'll be able to catch up. And that link will be posted both onto our webpage, and we will email it to you as well. Some brief housekeeping. To begin with, there's question and answers scattered throughout this webinar, so if we haven't answered your question by the end, we'll get to it then. Throughout the course of the webinar itself. When you are asking questions, you will be on mute. So instead, there is a chat window which you can open and you can send a question to panelists. We'll endeavour to answer as many of them as we can, but if we can't, we'll try and get back to some of you with the other questions. We do also ask that you keep your questions somewhat general. This is going to be, or everyone will see those questions, so we'd request that you keep your personal information to yourself, and that if you have any particularly thorny, tricky personal questions about your plan, that you get in touch with your Vision Australia service provider and they can provide some support to you directly. And lastly, a short survey will pop up at the end of the webinar. If you could please complete this, your feedback would be really valued. It'll help us to develop additional webinars in the future that would be of use for you. Okay, before we get underway, I'll pass over to Caitlin to introduce herself as well.
Hi everyone, my name's Caitlin McMorrow. I'm Vision Australia's National Operations Lead for NDIS, and I'm based in our Brisbane office in Coorparoo. And just to add to what Scott's already said around the housekeeping, if you're logged in on a device where you can't use the Zoom chat function for some reason, you can also email your questions to webinar@visionaustralia.org.
Thanks, Caitlin. Good pickup. Okay, so we will get underway. So today we're going to give you an overview of how you can make the most of your NDIS plan. We're aware that it can sometimes be challenging to get started or to access services at times with the NDIS. So this webinar will focus on people who already have an NDIS plan, who might be accessing services already and want to take it to the next level. So you may have already met some of your goals in your first plan and want to try something new or access a different type of support. We'll also talk through how you can identify what these might be and to navigate the complexities of the NDIS to do so. Now, what we're going to discuss, we'll look at the NDIS journey and using your plan, depending on what point you are in accessing the NDIS, how to understand your plan, what might be included in your plan, and some other things that could be included as well that may be a little bit less common, how you can update or change your plan if required, or the services you're accessing, a number of tips on how to manage your plan to get the most out of it, and we'll cover over a few of the other services from Vision Australia. And as I mentioned, we'll also have some time for questions. I should mention we are presenting a PowerPoint slide with some information. We will read through and explain everything on that as we go along as well. Over to you, Caitlin, for the NDIS journey.
Thanks, Scott. So on the PowerPoint slide at the moment, we've got an image that shows the various stages of the NDIS journey, and I'm going to talk through all of those now. So I guess one of the key points in getting started with your NDIS journey is to understand how the scheme works. Essentially, activities, services and supports are funded as an individualised package that's specific to your needs and goals and is tailored to those. The NDIS is administered by the National Disability Insurance Agency, or NDIA. There are a few principles that underpin the scheme, if you like, and the first one of those is one that you'll likely have heard a bit about already, and that's choice and control. Essentially, it's the idea that you choose the services and supports that you want and the providers that you want to work with. So it's based around the principle that the scheme doesn't fund services that you don't want or that you don't get value from. Another key principle of the scheme is around reasonable and necessary supports. So any supports that are funded in your plan have to be related to your disability. The scheme doesn't fund supports that are related to things like your daily living needs, or that would be better funded by other mechanisms that are in place for all Australians, such as the healthcare and education systems. And finally, funding in your NDIS plan is structured around goals, and products or services need to be linked to those goals in order to be funded. So they're quite centrally important. The next stage in the NDIS journey is to work out whether you're eligible. You need to be aged under 65 at the time that you apply for the scheme. You also need to be an Australian citizen or a permanent resident, and you need to have a disability that's likely to mean that you require lifetime support from the scheme. Once you've worked out whether you're eligible, you can apply to the NDIS by completing an access request form, which needs to include evidence of your disability. And then once you've been granted access to the scheme, the next step is to create your plan. So at that point, you'll be asked to think about what your current needs are, but also to think about your goals for the future. And you'll have a meeting with your local area coordinator or an NDIS planner to put that plan together and work out what funding and supports you'll need. Then we get to the point which is really the subject of today's webinar, which is using your plan. So this is where you select the services that you want and the providers that you'd like to work with. And then generally, after the first year of your plan, we have the final stage there, which is review. So usually after the first year, you'll go through a plan review process to look at how you went in achieving your goals and also to look at your needs for your next plan. So today we're focusing on using your plan. If you're interested in other aspects of the process, such as applying for the NDIS, you can view some of the existing webinars on our YouTube channel and also keep an eye out for upcoming ones. I think our next upcoming webinar is going to focus on reviewing your plan and goals. So you might want to keep an eye out for that one as well. So let's talk a little bit about understanding your NDIS plan, because before we talk about using your plan, it's good to understand how it works. There are some high-level criteria for all NDIS supports, and all of the supports that you receive under the NDIS need to be in line with these criteria. So, as I mentioned earlier, any supports that are funded as part of your plan need to be related to your disability. They can't duplicate other funded supports that you already receive. So if you get funding for a particular thing from another funding body, or if it's better funded through the healthcare system or something like that, then the NDIS won't duplicate that support. And the NDIS can't fund your day-to-day living costs that aren't directly related to your disability support needs. So I guess as an example of that, the scheme might fund a support worker to assist you with shopping, but it won't pay for the groceries because that's more of a daily living cost. So when thinking about the types of supports that are eligible for NDIS funding, the NDIS will consider funding things that help you to get out and about, things that help you to communicate, supports that help you to be independent at home, things that help you to stay connected with your community and to contribute to it, and things that support your education and learning. So we'll go into some detail and examples later about how this funding might appear in your plan and how you might access it.
Thanks, Caitlin. Before we move on, I'll just remind everyone that as we're going, please send in your questions. You can do that through the Zoom webinar chat, or you can email webinar@visionaustralia.org, and we'll be able to answer those as we go and throughout the webinar.
Thanks, Scott. So let's have a look next then at what's in your NDIS plan. So your plan is broken down into a series of support budgets and support categories. And broadly, there's 3 support budget areas where you might be provided with funding. So the first one is core supports. And these are supports that help you to live an everyday life, but they might not necessarily be focused on building your skills. So the kinds of things that we might see funded here would be group social supports, such as school holiday programs, and also consumables funding for low cost and low risk technology. The second funding category that you're likely to see is capital. And these I like to think of as more costly or long-term investments. So the kinds of things that we'd see funded under here are complex assistive technology and also home modifications. Then the third budget category is capacity building. So these are supports that are really focused on building your skills. So examples where we might see this are things that help you to improve your daily living skills, such as allied health and therapy services. Group therapy might be covered under there as well, and other capacity building group services. And also you may see funding for support coordination under your capacity building budget. We won't go into that too much today because it's not applicable to everyone, but it's probably good to say at this point that you may be eligible for support coordination to assist you in accessing the supports in your plan. If you are, your service provider or your support coordinator will help you understand what that support is and how to access it. But you may see funding for it in your plan. So that's all quite high level, and I'm sure you've got questions about how it might apply to you. But before we take the first round of questions, let's put this all into context a little bit with a case study and some examples of supports and how they might apply to your NDIS funding. So this is a made-up example. The participant has met some of his goals, but he has a fair amount of funding remaining in his plan. So we're moving on to our case study now, if you're following along with the slides, which is Dan Redman. So Dan has Stargardt's disease. He's been legally blind for a little over 3 years. He's quite independent, but he's pleased that the NDIS may offer him additional supports and help him to brush up his skills. Dan has a book club that he's a part of. He regularly goes to yoga, and he has 2 kids, which can make it challenging to juggle day-to-day life. And he also loves baking. So Dan's been accessing some orientation and mobility, but he's now reached his goal to navigate to his new job independently. He's found that with 6 months to go in his plan, there are a lot of remaining hours, and he's concerned that that might impact his next plan, and he'd like to look at some new goals. So we're going to have a look on the next slide at Dan's new goals, and we'll work through them one at a time and think about some of the supports that he might be able to access. So the first one is Dan's son has started soccer with a new club, and he'd like support to learn the new travel route.
Yeah, so this one's an interesting one, Caitlin. It's not that dissimilar to some of the service Dan has been accessing already. So we'd probably be thinking that this would have some additional orientation and mobility support around learning a new route so that Dan can go independently and support his son at soccer and sit in the rain on cold Saturday mornings along with all the other soccer dads.
Sounds great. Okay, Dan's second goal is around his new job. So for his new job, he'd like to be able to coordinate his outfits, but he's not quite sure what clothes go with which. And he's hoping he might be able to get some technology to support this. What do we think about that one, Scott?
Well, I think there's a couple of options with this, and some of it will come down to assistive technology. So Dan could look at getting a pen friend labeler or something similar with laundry labels and access his consumables funding in the NDIS plan in order to purchase this. He then may also like to have some therapy support from an occupational therapist who could help him to learn to use the new pen friend labeler, but also come up with some strategies for organising his wardrobe.
Excellent. Okay. Let's move on to Dan's third goal then. So he has a bad back from his hobby of woodworking and needs some physiotherapy. What do we think about that?
You can tell that I came up with this case study given that I do a bit of woodworking myself, can't you? So this one's an interesting one. The NDIS won't fund physiotherapy. That's something that would be considered, in this instance, at any rate, a health-related support that should be funded from the health and the mainstream system. However, it's also a good one to think about or to think differently about this. So physio for a bad back itself won't be funded, but when we think about why Dan might have a bad back doing woodworking, that could well be because of his the Stargard's disease and the vision impairment that he has. He would be potentially hunching over his workbench more so than would be normally expected. And so in that instance, we might look at some occupational therapy training for woodwork. We could look at some assistive technology around magnification for fine work and detail work. And those sorts of things could be used to prevent him from getting a bad back in the first place. And they would be funded because they're directly related to his vision and therefore disability.
So definitely one of those ones where we might need to think outside the box a little bit. Okay, Dan has always wanted to try bungee jumping. Could the NDIS support that?
No, and so again, they won't fund the ticket for bungee jumping or something along those lines. That's considered a mainstream activity, although not mainstream for everybody, I imagine. We do have an image of someone doing bungee jumping on screen as well. Again, let's think about it a little bit differently though. Depending on how confident and comfortable Dan is with doing bungee jumping, he might benefit from having some occupational therapy to support the safe use of the equipment, or he may need some O&M to get to the facility if he's going regularly and on his own. So while they won't fund the bungee jumping itself, there may be associated supports that could be worthwhile as well.
Good to know. And Dan's obviously a much braver person than I.
Me too, yes.
Yeah. Okay, so earlier we had a look at support categories and budgets in plans at a fairly high level, but shall we revisit those, Scott, using Dan as a bit of an example to give people some context in terms of how they work?
Yes, that's a good idea. And again, at the end of this section, we will start looking at some questions. So if you have any, make sure to send them in as we go. So earlier, yep, we looked at the support categories and budgets at a high level. When we're thinking about Dan as a case study, let's start applying that to there. So Dan wanted to be able to do some, or to manage his wardrobe and understand what clothes he had to wear to work. We mentioned consumables funding for a pen friend labeler and laundry washable labels as an example to help keep track of work outfits. Consumables funding comes under your core budget, which is that first one we looked at. The second budget is around capital, and so that's typically assistive technology or home modification assessments. And Dan may require access to capital supports in order to do a home modification assessment for improved lighting in his wood workshop, or depending on the level of assistive tech for his workshop, he may like to get an assessment and have capital funding for that. And the third budget area is around capacity building, and that's where the bulk of the services for those goals that we looked at earlier would fit. The orientation and mobility for Dan to travel to his son's soccer game, an OT to help Dan develop strategies for organising his wardrobe and learning to use a pen friend labeler, woodworking group classes perhaps to build skills, or OT support, occupational therapy in his workshop itself, and potentially occupational therapy support to help him access the bungee jumping equipment safely. So we'll pause here and we will go through a couple of questions that have been sent through, and if we don't answer them now, it might be because we're going to address those topics later on. So we haven't had any questions come in today over the chat yet. We do know it's working because we have had one person send in a comment. So if you've got any, please feel free to send them through. We have had a couple of questions come in ahead of the webinar, so we'll start with some of those. And one of them is around assistive technology and a question about why it might be taking so long to have an item that was assessed appear either approved or denied or show up in their plan. Caitlin?
Yeah, so we know that's been taking quite a bit of time with the NDIS. They have changed some of their processes in the last few months. So we're hoping to see those wait times decrease a bit now that some of those new processes are coming into place.
Yes, unfortunately, that is something that is sitting with the agency and the requirement to have an assessment approved. So they have a backlog that they're working through. Another question about assessment, assistive technology, and kind of feeds straight into that. How do I purchase off-the-shelf products? Do I need NDIS approval before purchasing products?
So,
And Caitlin, I might pause
yeah,
because we have had another question come in over the chat that sort of touches on that, so we may be able to address them all at once.
sure.
What is a high-risk assistive tech item? So if we think about the purchasing off-the-shelf products and where an approval might be required.
Yeah, so in terms of purchasing off the shelf products that are sort of low cost, low risk items, um, those can usually be purchased from consumables funding. So as we talk through with the example with Dan, some examples of things like that might be low cost items such as laundry labels, pen friend labelers, things like that where you don't necessarily require a lot of training in order to use them. As you mentioned, they're off the shelf products, so you can just purchase them and use them as they are. So usually those are fine to be purchased from your consumables funding. In terms of what constitutes a more high risk item of technology, I guess something where you might require some training in order to use it, those kinds of items where they're more complex solutions and there might be a whole heap of different options available. So the NDIS in those instances will usually want to see an assessment just to make sure that that's the most appropriate solution for your needs and that, you know, all the relevant options and things that might be available to you have been considered. So hopefully that helps to answer that one a little bit. Did you want to add anything, Scott?
Yes, that came from Malcolm, and he has had a follow-up question. So what is a low-cost item? And there's two categories or decision-making frameworks around assistive technology. One is whether it is low cost, and one is whether it is low risk. If it's both of those, it's a consumables, and you can purchase it without an assessment. It still has to be related to your disability, of course, but the cap for that, depending on how much funding you've received, is $1,500. And so that would be anything under that is a low cost item. Anything above that would require an assessment. However, if it's under $1,500 and is still high risk and would require training to use safely, that would require an assessment as well.
So examples of where we might see that would be some of the secondary sort of orientation and mobility devices, for example, where they're fairly low cost. They would definitely fall under that $1,500 cost cap, but there might be some risk to you if you went out into the community and used them without training. You might place yourself at some risk. So that, I guess that's just an example of an item that would be low cost but wouldn't necessarily meet the low risk criteria. And as Scott said, it needs to meet both to fall under that consumables category.
And you can have a look on the NDIS website for participant information on assistive technology, where they have a couple of examples and some frameworks to help with that. We've had two questions come in that I'll take together, which are for Kylie and Dennis, around what might be a mainstream or what might not be mainstream activity. So one is around an exercise physiologist to assist with the gym for exercise. It's dangerous to walk in your area due to no footpaths and the night speed limits. And Dennis around interested in photography. Will the NDIS fund photography classes and lessons? So this comes back to the intersection between mainstream and disability supports. Kylie, your one is a little bit more closely linked to disability supports. If you think about it as needing some support in the gym to be able to use the equipment safely, if you want a community support person to attend and help you actually go to the gym, travel to the gym, if you have the funding for that, you may be able to get support there as well. Dennis, for your one, generally the NDIS might not fund the photography class itself, particularly if it's run by a mainstream provider. However, if you need some support from an occupational therapist or others to help you use and navigate menus on the camera, things of that nature, then they would fund something along those lines. Okay, so we have another couple of questions about assistive tech that we might try and take together as well. And one is around, we've had a couple of questions come in both prior to and during the session on talking microwaves from Kylie and Yvonne and others around purchasing a talking microwave with the low risk budget and being told that you needed an OT report. Why might that be?
Yep, so the NDIS has specifically said in its guidelines that in general, talking microwaves shouldn't be purchased as part of your consumables budget. So that's likely why you've been told that you require an OT assessment for those. Scott, did you want to add anything to that one around how they get funded?
Yes, so the only other side of this, and this is not a comment on whether Vision Australia agrees with the decision, but the NDIS have decided that talking microwaves or microwaves in general are a mainstream item. Most people across Australia would be expected, or you wouldn't be uncommon to have a microwave in the home. The argument then is around whether the talking microwave itself is something that is specific for blindness and low vision. Generally, what we find is they are requesting an assessment, and they may approve it. However, they may ask you to fund the difference of cost. Or they will only fund the difference in the cost, so that you will be required to pay for the base cost of what a microwave would be, and the agency will fund the extra funding that might be required for a talking microwave, as that aspect of it is disability specific. There's a number of different items like that which are, I'll say, controversial or problematic in working with the NDIS, and so we recommend that you would speak to your Vision Australia provider to get some advice on those ones, or any others that you may have that are similar to that. We'll take one more question and then we'll move on into the rest of the slides. And then we do have some time for questions at the end, so we'll come back to them as well. So Courtney asks, in the capacity building budget, there are lots of different areas such as improved daily living skills, improved health and wellbeing, and so forth. If I'm self-managed, can I use my capacity building budget across these different areas if they match my goals?
The short answer to that, I think, is no. So generally with your core supports budget, you have a little bit more flexibility to move funding around between different categories. Not so much with capacity building. Often the funding's restricted to the category that it's provided in, and you can't then move it elsewhere within that broader budget area. So that has proved a little bit tricky for some people wanting to access really specific types of services and things like that. So we're always happy to work through that with you as needed. If you have a question or you're not quite sure how a particular activity that you'd like to do can be funded, then you can contact your Vision Australia service provider and they should be able to work through that with you.
Fantastic. Thanks, Caitlin. So we will come back to other questions later on, but we will keep moving for now. So what we've done to date, we've looked at what's in your plan. The next section will cover off things like if at some stage you might decide you might need to change your goals or the services you're accessing, how could you do that and how can we help you with that process? Caitlin will talk us through that now.
No problem. So if you decide to change your Vision Australia goals or you want to take up a new activity that's covered in your existing NDIS plan, it's actually quite straightforward. Obviously, we'd recommend that you have a bit of a think about the activity and what you want to achieve and how it links in with the goals in your NDIS plan. And you can give Vision Australia a call and we can support you to meet whatever that new goal is that you'd like to work on. If you're not sure how to work out your activities, as I said, or if there's a particular activity that you'd like to do and you're not sure if it's covered in your NDIS plan or how it would be funded, then get in touch with your Vision Australia service provider and they'll be able to work through that information with you as you need. We might go on then and talk a little bit about some tips for managing your plan. And depending on how you chose to manage your NDIS plan, you can use the NDIS portal in different ways to keep track of your plan. So you can use it to do things like keep track of your plan spending and claim funds if you're self-managing. So on the My Place portal, you can also do things like view your current plan and your previous plans. You can check your contact details, see messages from the NDIS. You can also use it to upload documents such as assessment reports and service agreements. So if you've had an OT assessment or an assessment for some assistive technology, you could use the portal to upload a copy of that report so that it's viewable by the agency on your file. You can also use the portal to share your plan or parts of your plan with your service providers. You can use it to find providers for particular services that you might want to access. There's a provider finder feature on there which you can use. You can also create and view payment requests and manage service bookings and things like that if you're self-managing. Your local area coordinator will assist you to access and navigate the portal if that's something that you'd like to do. So feel free to get in touch with them if you'd like more information about that. It's part of the service that they provide to all NDIS participants as part of their plan. I guess the other thing to add is that it's never too soon to begin preparing for your next plan and setting yourself up to make sure that you can get the best plan possible. So I just wanted to talk through a couple of tips that you might want to think about once you have a plan to assist you in getting ready for that review process. As I mentioned earlier, that usually takes place after the first year, and the purpose of it is to see how you went in terms of meeting your goals and to think about your supports and the things that you'll need for your upcoming plan. So a couple of the tips that we'd suggest are to keep records of your services, including the types of things that you accessed, how they helped, what difference they made to you and how they helped you to achieve your goals. Also have a think about any additional services you need and new goals that you might like to work towards. It's also good to keep records around how you think you progress towards your goals. And also, if you haven't used all your service hours or all of the funding in your plan, it's good to have a think about any reasons why you may not have used them all. Was it that you had difficulty in accessing the services you wanted, or your goals changed, or various other reasons like that why you might not have used all your funding? So these are quite basic, but they're just prompts that can help you to explain as part of your plan review the funding that you've used and what your future needs might be. So I might hand back to Scott now to talk about a little bit more information on Vision Australia service areas and how they sort of fit within the context of NDIS plans.
Thanks, Caitlin. And to those of you who have been asking questions in the chat box, I have been trying to answer some as we go. So have a look there. We will send around answers to that afterwards also and come back to more of them at the end of this. So on screen, we have a list of Vision Australia service areas. You might recognise some of these as those you already access, or others that could be familiar from Dan Redmond's case studies. I'll walk through these supports now. And it might be worth having a think about how they could relate to different activities you currently do or that you'd like to do in the future. We'll mention the supports, and sometimes I'll use the language that is described by the NDIS or that might match the NDIS funding to help draw the dots between the two. So these can include emotional support and groups around supporting your inclusion as someone with disability, occupational therapists to support independence in the home and the community, mobility specialists to help you get around, stay safe and navigate the built environment, orthoptists to assess and help you make the most of any functional vision you have, education and employment support to facilitate independence and participation in the community, aids and equipment or assistive technology from our shop to assist with daily tasks or activities, and technology and training to help you stay connected and make the most of the assistive technology you do have. We also offer a range of other specialised services around early intervention for children and adolescents services, seeing eye dogs for independence, We have audiobooks in the library for leisure and learning, provide a range of different information and advice for clients and families. And we also have services and experts around My Aged Care and NDIS to help you access services as required. So, and obviously you guys would all be aware of this based on some of the questions we've had coming in, but a big change in the NDIS is the potential to have funded assistive technology. You can find a lot of these items on our web store, and we'll give a brief overview of this and how it might work as well now. So Vision Australia has an online store with a range of technology and equipment, some of which can be purchased through your consumables, and others of which may require an assessment, which is that low cost, low risk item that we discussed earlier. And of course, we offer a range of training to support you with your assistive technology as well. You can purchase online, or you can come into some of the stores and the Vision Australia offices where we have a range of equipment for you to trial as well and test before purchase. So before we go to answering some additional questions, I'll just do a quick summary of what we've covered today. A reminder that this will be, has been recorded and will be available for anyone who joined late or who has missed it. You'll be able to watch it back later on as well. Any questions you have, please send through to webinar@visionaustralia.org or the chat window in this webinar itself, and we'll start answering them in a moment. So today we aim to help you better understand your plan, to identify what can be in your plan, to consider some of the other services and equipment that could be included to help you work towards your goals, to look at how you can update or change your services with Vision Australia, some tips on how to manage your plan, and also what some of those other services from Vision Australia could look like. If you have any questions that we haven't been able to answer today, or any specific questions that you want to speak to a service provider about, you can either contact your service provider, you can call our helpline on 1300 84 74 66. You could email info@visionaustralia.org, or you can visit or contact your local office as well. Okay, we'll go back and answer some of the questions before we wind up today. Again, we've been answering a couple in the chat window, and there have been some new ones come through. So I will try and keep up with those now. So I travelled from Ruth asks the question, she's travelled from a reasonable distance to Perth to visit Vision Australia, and would like to know whether this travel is claimable. And in this instance, it was up to 3 hours there and back. I think the answer to that is so every person can get travel funded in their plan up to a certain point. Generally, it has been replacing what used to be a nationally funded support of the mobility allowance, and people would get varied levels of funding under that. In NDIS plans, they're typically funded as well. You may get different levels of transport and travel funding and support. With that one, you generally get it as a weekly or fortnightly payment, and it's unlikely you'd be able to claim in the same way as you might be thinking about other actual supports, but that travel funding could be put towards that if you wanted to. Unfortunately, generally, travel of that nature is not funded under a line item or support. 6 hours total travel, sorry, yeah. Dennis asks, because of my location, I've been unable to utilise much of my social and community supports. Will this work against me when I'm coming up for my next plan? Caitlin?
That's a tricky one. I think, provided you can give some explanation as to the challenges that you've had in utilising those supports, your planner might be able to work with you to come up with something that's a bit more suitable for your next plan, or perhaps some supports that might help to link you in with other services and things like that. That's a tricky one, Dennis, and I think it's quite a common one where people don't necessarily utilise all of their funding because they've had some challenges in accessing services. So I wouldn't like to say that it would be that it would work against you in your next plan, but it might be good to have a think about, some explanations in terms of the difficulties you've had in accessing the things you wanted to, so that we can kind of do some work with you in your next plan to try and combat some of that.
Excellent. Thank you, Caitlin. Okay. Kylie's been told that a plan review that the transport budget that was given fortnightly would stop as of 1st of July. Is that correct? I don't believe that is accurate. As far as we're aware, the transport funding should still continue to be funded as a whole. However, in your case, it may be that the reviewer or the plan review has decided for some reason that you are not eligible for that transport support. That would be unlikely if that's the case, and if it is, I'd recommend getting in touch so that we could provide some support. That shouldn't be the case for everybody. Hussein asks if the funding can be used outside of Australia, for instance, if for any reason a family member needs to move overseas. Caitlin?
I think that would depend a little bit on the context that you're referring to it in, but no, generally not. Your NDIS funding can't generally be used to support a family member to do something, and there's generally restrictions in place. If you're traveling overseas yourself, you may need to let them know about that, because that might impact your plan.
Yes, and you won't be able to spend the NDIS money overseas, although it is transferable within Australia. So if you're in Victoria, you can use it when on holiday in Queensland if you needed to. Mandy's raised a good point, and one that I had missed, that with travel for remote or very remote regions, you may be able to claim the travel funding yourself under therapy or capacity building supports due to that remote distance. But we would recommend that you check with your LAC or NDIA to make sure that's appropriate. Okay, so I'm just trying to find the next question, apologies. So Neil had a question earlier on about sporting goods groups for blind and vision impaired people, and an example would be blind skiing. So Neil wants to get better and compete internationally. And some of the training is specific for blind people and most isn't, but it's all around helping to achieve goals. So for something like that, most ski equipment might not be specific to blind people. In that instance, that ski equipment would not be able to be purchased. If you needed to modify the equipment, or if you needed to buy specific equipment so that you can ski because you are blind, then in that instance, they would potentially be able to fund it. Around the sport training, or the training that might not be specific for blind people, if you need that additional training specifically because you are blind, that might be able to be funded. If it is something that would be considered someone who is sighted and training to compete internationally expected to be funded for, or expect to pay for themselves, the same would apply for you. So in general, you may not be able to access additional sport-specific training as a result.
And I guess that comes back to the point we raised earlier around any supports that are funded needing to be sort of quite clearly linked to your disability. So yeah, some of those borderline ones can be a little bit more tricky to work out. Yeah.
And we would recommend you either speak to the agency or speak to a Vision Australia representative to get some additional support on something like that. Suzu asks, can I use the funding for the eye health treatment that's not covered by Medicare, such as acupuncture for eye illnesses?
No, is the short answer. I think that would probably come under something that the agency would expect to be covered by the healthcare system, even if it's not covered by Medicare. Would you agree with that, Scott?
Yes, and this is some of those tricky ones where, while it is technically a healthcare issue, whether or not the healthcare system actually funds it, that's not something the NDIS will address. So Courtney has had a planner let her know that she's not allowed to consider or include provider travel in my child's early childhood early intervention package. So the funding that's received for hours of service delivery might also need to be used to cover the cost of providers travelling to us. Is that correct?
I think that's a fairly common one, isn't it? Where travel comes out of the hours of service delivery that are provided in the plan. It seems a little bit odd that that wouldn't be taken into account, though, particularly if you're somewhere regional, and that's likely to have an impact on the hours of service that you might get.
Yeah, that's correct. So you should be getting that funding included in your plan for provider travel, and you should be considering and including that in your request for services. However, generally you won't see it as a separate line item in your plan. It will be captured within the overall capacity building budget in that instance. So where they're saying that provider travel won't be funded separately, that's not technically how they should be doing it. They should be capturing it in some form. So we might be winding down. There's not a huge amount of unanswered questions. There's a couple we'll try to come to shortly, or come to back to you afterwards as well. And just a reminder that there is, when we finish the webinar, a survey that will pop up. We'd love for you to complete that. The feedback will help us to determine what additional services and what kind of webinars and information would be useful in the future as well. Yeah, okay. So that might be all for today. We've tried to cover off most of the questions, at least theme-based. I know there's a couple that we have missed, and we will follow up with those as well. And we would like to thank everyone for attending. It's been fantastic. We hope it's been of use for you. Reminder that the webinar will go up online for you to be able to listen back to later on, or if you joined us later as well. Thank you very much, everyone.
Thanks, everyone.